My name is Cortes-Garcia. Today we're going to do a case study. The case study is about a boy named Jack. Jack is a 17-year-old boy who is on the high school swim team. He presents with sudden onset of right ear pain that worsens at night. He says the pain intensifies when he touches his ear and he has a feeling of fullness. On examination, the right external ear canal is edematous and erythematous with yellow crusting. His temperature is 98.7 and he has intact tympanic membranes bilaterally. The patient has been prescribed ear drops and a family member will be instilling them for him. Jack has pain to the right ear, which is painful to the touch. The outside of the ear is red and swollen with yellow crusting. Because Jack doesn't have a fever and both of his eardrums are okay, the infection is likely to be isolated to the outside of the ear. The doctor will most likely diagnose Jack with an ear infection commonly known as a swimmer's ear or otitis externa, which basically means inflammation of the outer ear. A swimmer's ear or otitis externa is an inflammation, irritation, or infection of the outer ear and ear canal. So how did the infection happen? Well, the ear has a thin layer of wax which protects the ear from infection. Infection happens when this layer of wax is removed, sometimes by cotton swabs, exposure to unclean water, or scratching. In Jack's case, he's in the swim team, which places him at a higher risk for swimmer's ear. Swimming pool water is not as clean as one may think. A pool should not smell strongly like chlorine. Jack may have used cotton swabs or scratched his ear with his fingernail in an attempt to clean out his ears. The bacteria in the unclean water from the pool may have likely caused the ear infection. So how do we treat this infection? Well, typically, doctors will prescribe antibiotic ear drops for this type of infection, just like they did to Jack. These ear drops are placed in the infected ear for about 10 to 14 days. Now, had the infection been worse and traveled inside the ear, then the antibiotics would have been in form of a pill. Now, the other things to consider is Jack had some inflammation and swelling right in the ear and had some pain. So doctors will also prescribe, to go along with the ear drops, some type of corticosteroids, which is for the swelling and the itching, and possibly Tylenol or some type of pain medication to alleviate some of that pain. So how do we give these ear drops? These ear drops are given to the ear which has the infection. This is done by basically asking Jack to lay on his side to expose that right ear. Now, the family member who's helping Jack would wash their hands initially. They would place the amount of ear drops onto that infected ear, as prescribed by the doctor, in the fashion of pulling back the ear a little bit and pulling it up. And the diagram which follows will show how that is done. This is to expose the ear canal. Once those ear drops are put into that infected ear, then Jack will remain in that position for about 5 minutes. And that's to allow the ear drops to coat the part of the ear which has the infection. After that is done, then Jack could resume his regular activities. So in conclusion, if you have any type of pain to the ear which is persistent or is accompanied by any type of leaking or crusting, definitely go see your doctor. Ear drops may be prescribed, and again, it is important that when you give the ear drops, either to yourself or somebody's giving it to you, definitely remind them that in adults, we're going to pull the ear backward and upward to expose that ear canal. If it happens to be a child, anywhere 3 years or less, then you're going to pull the ear again backward gently, but this time you're going to pull it down, and that's exposing the ear canal so those ear drops could go where they need to be. Now, the infection could last about 10 to 14 days. Now, Jack, in his specific case, he could go back into the pool in about 10 days, and that's about typical, which is towards the end part of that infection. Now, things to remember in terms of prevention: you could always shower before going and after using public swimming pools, which is very important. Now, do not place any type of foreign objects in your ear, again, because you might be exposing bacteria which was not there before. You're scraping it off with that foreign object and replacing it by that bacteria found in that object. So I hope this helps. You all have a great day.